So it is the top of the hour, so I'm going to go ahead and get started. Um, and luckily, the first few slides are introductory, not our guest speakers. So as folks continue to filter in, they are not missing a lot, or they're not missing the important stuff at least. So thank you for joining us today for Discovering Library Science and Health Literacy, a high school push-in program, with our guest speakers from Weill Cornell, and we are very excited to have them here. Before we get to their actual presentation, start with um, the usual reminders. Please use chat for your comments and to ask questions. My colleagues, Benny Finch and Kim Carlo, are in the chat to answer any technical difficulties or to make sure that we don't lose any questions. We will be having those questions answered at the end. We have closed captioning available. We are using the Zoom closed captioning. So if you look at the taskbar, you should be looking for the double C to start that. The session is being recorded. We are hoping to have it up in about 2 weeks, and the recording will be shared with everybody who registered. And we do have multiple continuing education CEs available for this session, including CHIS, the CHIF, and the MLA credits, as well as CHES, the Community Health Education Specialization from NCHEC for our public health partners. So for folks who are getting CHES, CHES, um, that is done through the evaluation at the end, and have your CHES ID number ready for that. Um, we, the CHIS and MLA CEs, there's a code with that as well. We would really appreciate you completing the evaluation, but you will need to ask for the code. It did not get correctly populated with the evaluation. So if there are any questions about CEs, please let us know, and we will make sure that you are connected to the ones that you need. And just a real quick introduction to who we are and why we are here today, or why we are the ones bringing you this presentation today, I should say, is that the network of the National Library of Medicine is the outreach arm of the National Library of Medicine, which is an institute of the NIH. The network itself is broken up into regions and offices and centers. Where you are, you can also connect with the network. Um, my name is Sarah Levenletter. I am an outreach and education coordinator for Region 7. And we cover New England and New York. So that is the nitty gritty. So we can actually do the more important stuff and pass you off to our speakers today. So as I stop sharing and as their slides come up, I want to first introduce our speakers. We are happy to welcome Terry Wheeler, a librarian and director for the Samuel J. Wood Library. Wheeler has directed libraries for 35 years and actively works to improve the lives of underrepresented communities in NYC. Her prior research on library leadership and information-seeking behavior has been widely published. Wheeler's passion for developing innovative uh, high-performance teams has revolutionized the future of 3 libraries during her career. She now focuses on mentoring, strategic planning, and leadership development so she can inspire the next generation of executive and library. Oh, sorry, don't look at the chat while trying to read. Uh, and library leaders. This work to introduce high school students to the profession of librarianship is one contribution to the future of the profession. Diana Delgado, Associate Librarian and Associate Director, Information Education and Clinical Services, Samuel J. Wood Library. Delgado leads a team of faculty and staff committed to delivering a range of programs, including access, instruction, outreach, evidence synthesis, scholarly publishing, patient education, and clinical librarianship. Additionally, Delgado has served as a member for the BIPOC Become Librarians initiative, aimed at introducing undergraduate students from BIPOC backgrounds to careers in library and information science. With over 20 years of experience, Delgado has taught and supported faculty, students, and staff in their professional development. Sarah T. Jewell, Assistant Librarian and Assistant Director, Clinical Service, Samuel J. Wood Library. Jewell is the manager of the Myra Mahan Patient Resource Center, a patient-facing medical library which aims to make science-based information easily accessible to patients. She has 2 decades of service as a medical or science librarian and has written and spoken extensively on systematic reviews and other evidence synthesis. Michael A. Wood, Assistant Librarian and Head Resource Management, Samuel J. Wood Library at Weill Cornell Medicine. With an MLS from the City University of New York and over 20 plus years in the profession, Wood's primary role centers around collection development and management activities that support patient care, research, and education at WCM and its affiliates. Wood is an advocate for fair access to resources and has championed open access to publications whenever possible, especially the elimination of article processing charges through transformative arrangements. Moreover, Wood is also a strong supporter and advocate for the introduction of the profession of librarianship to all students at the middle and high school levels to impact the future growth of the profession in a variety of ways. Andy Hickner, Assistant Librarian and Education Outreach Librarian, Samuel J. Wood. Hickner has extensive experience developing, delivering, and assessing curriculum integrated instruction for students and trainees in the health sciences. And finally, Jessica Boyle, Anthropology, Human Skeletal Biology, and currently serves as the Science Development Chair, a peer collective teacher, and a new teacher mentor at Kappa International High School. Jessica is also an instructional leadership team member and a recipient of the 2024 Sloan Award for Excellence in Teaching Science and Math. With 20 years of classroom experience, Jessica successfully led multiple teams through various inquiry cycles, promoting best practices within her school district and classroom. Presently, she teaches anatomy and physiology, as well as international baccalaureate biology, and ignites curiosity in her students by implementing task-based learning with a hands-on approach that enhances critical thinking and rigor, increasing student success in high school and beyond. And with that introduction to our wonderful speakers, I will turn it over to them.
Thank you so much. Good afternoon. I would like to introduce today's speakers, Diana Delgado, Sarah Jewell, Michael Wood, Andy Hickner, Jessica Boyle, and myself, Terry Wheeler. 5 of us are librarians at Weill Cornell Samuel J. Wood Library, and Jessica is a peer collaborative teacher for the New York City Department of Education and is an educator with mentoring in medicine. If you have questions during the presentation today, please put them in the chat. And if you have a speaker that you would like to answer your question, please also indicate the speaker. We will have at least 15 minutes at the end of our presentation today for questions and answers. The NNLM Region 7 office will also post the slide deck and recording of today's presentation for future reference. The Community Health Ambassador Program, or CHAMP, curriculum was funded by an Institute for Museum and Library Services, or IMLS, 2-year grant. The partners, whom we will meet shortly, developed and delivered a health literacy and introduction to librarianship curriculum to high school students in Thurgood Marshall Academy, Mount St. Michael Academy, and Knowledge and Power Preparatory Academy, also known as Kappa, International High School. This curriculum was presented over 2.5 weeks by pushing in to an established 10th, 11th, or 12th grade anatomy class. Our 5 Weill Cornell librarians shown here partnered with leaders and teachers from Mentoring in Medicine, a nonprofit organization whose mission is to raise awareness of high school students to health sciences careers. This mission was fundamental to the development of this grant. What mentoring in medicine does is to build partnerships with local high schools so it can introduce high school students to health careers through an anatomy curriculum it has developed around body systems. Through these partnerships with local high schools, mentoring in medicine pushes in to established high school anatomy classes to introduce their curriculum and health careers to high school sophomores, juniors, and seniors. Dr. Lynn Holden and Andrew Morrison lead mentoring in medicine, and Jessica Boyle, whom you will meet today, is one of their award-winning teachers. We also identified an advisory board of nationally known librarians who are Sandra Franklin, who I noticed earlier today is attending this presentation and so may have a few comments at the end. Dr. Shannon Jones, Pamela Espinoza de los Monteros, Dr. Kawana Bright, and Barnaby Nicholas. We met with these advisory board members monthly to review our progress and work products in advance of delivery. We started with modules and learning objectives identified in the grant. We developed what we thought was an age-appropriate curriculum with activities, a final project exemplar to show students what their project would look like at the completion of the curriculum, and a grading rubric so that they could see how they were graded. The first year, every librarian developed one, or in two cases, two modules. We delivered this curriculum, then we got student feedback in focus groups. This feedback indicated that there was too much lecture and the modules lacked cohesiveness. Based on that feedback, high school teacher on our team, Jessica Boyle, took the lead in revising the modules, activities, exemplar, and rubric. Based on her recommendations, we dropped two modules, added a module, and decreased content in other modules. We revised the pre- and post-test questions and taught the questions and their answers appropriately in the curriculum. We taught the revised curriculum the second year and saw enhanced student engagement. Student feedback assured us that this was now much more engaging for learners. We then created the toolkit for any of you to take and use. Here is a link to the toolkit, and you'll see it in the chat.
Hi, everyone. I'm Jessica Boyle, and I'm a science teacher at Kappa International High School. For our Objective 1, examine best practices for student engagement and why they work. In the redesign of the curriculum, the focus shifted to small group, task-based learning that incorporates relevant examples from students' lives. We created an engaging prompt where the students act as medical librarians hired by the celebrity to debunk the myths about their disease to increase interest. This approach encourages students to apply the skills they learn throughout the modules instead of simply memorizing information. To enhance student interest, students chose from a list of celebrities to ground the task. Each module decreased teacher talk time, lecture-based teaching, to less than 5-minute chunks and included a portion of the final presentation to create. Throughout the modules, students collaborate in teams and receive targeted, actionable instructor feedback during student work time, all while using student-friendly language in the rubric, exemplar, and learning targets. The reason why these practices work is because students need to see relevance in their learning to make connections to their own lives, which increases student engagement and interest. Using student-friendly language in the learning target and rubric increases student access to the material. If students do not understand the task, they cannot be successful. Therefore, providing an exemplar and modifications and supports, if necessary, shows students what high-quality work looks like, allowing students to produce polished presentations. By teaching the modules through performance-based assessments, students can practice the skills they learn in class and apply them to the culminating task. Finally, having each day represent a module creates bite-sized student deliverables where teachers can provide feedback without overwhelming the students. Objective 2, identify various activities and methods used to increase engagement and promote student-led learning. In order to deliver the new curriculum, many teaching activities were used to decrease teacher talk time and increase the students carrying the cognitive load. The jigsaw method is a trusted best practice, allowing groups of students to become experts in one library science field and teach their peers about what they learned. By tapping into students' interests, such as salary games like Guess My Salary with a real librarian, and having students generate questions to be answered by librarians in various fields, the content became practical. Anytime students move around the classroom, like in the Four Corners method, students' engagement and discussion are increased. All of these methods use different groupings based on the activities, so the classroom is dynamic. Finally, by having portions of the performance task completed daily, students are not overwhelmed with one large project. Instead, students receive enough time to create a polished product, all while gaining actionable feedback along the way.
Hello, everyone. I'm Diana Delgado. We will now proceed with sharing components of the curriculum. Please note that the curriculum is publicly accessible and may be used partially or in full to facilitate instruction on health literacy and awareness of the library profession. Module 0, Introduction to the Curriculum. In our first module, Module 0, Terry and I oriented the students to the curriculum, presenters, and the members of the advisory board. During the first session, an online pre-test was given consisting of 10 multiple choice questions, 2 questions per module. An identical post-test was administered on the last day of class. The tests were valuable in identifying course and session level learning outcomes. This slide shows 2 examples of questions that were used in the testing. In addition to testing, we measured student learning through a group performance task using a scoring rubric. The rubric was introduced to the students on the first day. The rubric contained 5 domains: misinformation in popular media, disease content knowledge, evaluation of a source using SIFT, citations and references in APA format, and presentation skills and quality. Teams could receive up to 4 points per domain, with 4 points representing above standard, 3 meet standard, 2 approaches standard, and 1 below standard, for a maximum total of 20 points. The scores from the instructors and teacher were averaged to produce a composite score for each of the groups. One of the most engaging parts of the curriculum that we introduced in Module 0 is the final performance task. In this project, students step into the role of a medical librarian hired by a celebrity to address misinformation about their recent diagnosis circulating on social media. Their mission is to research the disease using credible sources, identify misleading claims, and create a campaign that educates the public and reduces stigma. The students present their campaign to a panel of peers. This task is powerful because it blends real-world relevance with health literacy skills. Students build research skills and develop empathy and advocacy by tackling stigma. Their performance task also encourages collaboration, creativity, and gives them a glimpse into the vital role librarians play in public health communication.
Module 1, Finding Credible Information for Your Disease Research. Students discuss their preferred sources for credible information and why. We introduce them to Medline Plus and use this slide to highlight the benefits of Medline Plus. We emphasize that Medline Plus provided unbiased information in multiple languages and was a public service maintained by the National Library of Medicine. This should be the first place they go for fact-checking any medical information. We then explained how to use Medline Plus to search for their celebrity's disease. Then we reviewed the exemplar, which was a poster about Lady Gaga's fibromyalgia, as you can see in this slide. This would be an example of what their finished product would look like. Here we see a definition of the disease, its cause, symptoms, treatments, and how common it is. Teams were encouraged to be creative, work together, and research their celebrity's disease. They had 10 minutes in this particular class to begin work, and each class had some work time included. The grading rubric that is shown at the bottom was accessible to students at all times, so there was transparency in the grading process.
Module 2, Career Introduction. In Module 2, we introduced students to the diverse and dynamic world of library careers. We started with a fun icebreaker, Guess My Salary, to spark curiosity and challenge assumptions about the profession. Next, students identified what they think is the most important thing a librarian does in a day. This led into a group research activity using the jigsaw method, where each group explored a different type of librarianship. We then wrapped up the collaborative activity called Ask a Librarian. Students generated thoughtful questions they'd like to ask real-world librarians. Librarians from the advisory board and from Weill Cornell Medicine provided answers that were then shared with the students in a later session. This module helps students see librarianship as a varied, impactful, and accessible career path. In this jigsaw-style activity, students explored different types of librarianship to understand the variety of roles within the profession. Each group was assigned a librarian role, such as medical, school, library director, college, systems librarian, or public librarian. They completed a worksheet specific to their assigned role, using provided resources, including helpful links for deeper research. After completing their section, students checked their work within their group to ensure accuracy and understanding. Then, in classic jigsaw fashion, students regrouped into new teams where each member represented a different librarian type. They took turns teaching their peers about their assigned role, allowing everyone to gain a well-rounded view of the field. This method promotes collaboration and peer teaching, key skills in both education and librarianship.
Hi, everyone. My name is Michael Wood, and along with Terry Wheeler, we presented Module 3, Find and Identify Credible Health Information. We define credibility in the context of health information. Then we discuss what makes health information credible. We also introduced the concept of bias and how to identify it, and considered what the word pseudoscience meant. We define credibility in the context of diets, as shown here, and we use an exercise to evaluate a fad diet, in this case, the carnivore diet, using Medline Plus and Wikipedia. Note the words we covered earlier, such as pseudoscience. We discuss how fad diets change, like fashion, and credible information should be based on clinical research that is peer-reviewed. We introduced a SIFT evaluation method to identify if information is credible. SIFT is an acronym for Stop, Investigate the Source, Find Better Coverage, and Trace Claims, quotes, and media to the original context. Terry will discuss each of the sections in the SIFT method.
So S is for stop and gives you your first impression about a website based on the domain name, .org, .gov, .edu, or .com, and its headlines. Here, students discussed their first impressions of the carnivore diet website. I is for investigate the source. We need to look up the author of the content and see if he or she is credible by their training and expertise. Here, students looked up the author of the carnivore diet website and determined his credentials. F is for finding better and trusted coverage and tells us the importance of fact-checking what the site says with coverage from other trusted websites like Medline Plus or Wikipedia. Here, students looked at a Medline Plus article on diets to see if the carnivore diet fit the description of a healthy diet. Then students looked up the carnivore diet on Wikipedia and discussed what they found. T is for trace claims, quotes, and media to the original context. The Wikipedia article for the carnivore diet provided the diet's history, and students shared where the diet came from. This article also covered the diet's health concerns. Students debated whether there was scientific evidence that the diet worked. You'll also see here that they clicked on various links within the diet and came up with these screens that are screenshot here that told them additional information about this particular diet and the website.
Hi, I'm Sarah Jewell, and I taught Module 4, which focused on health literacy, misinformation, and disinformation. First, we reviewed tips on talking with your doctor and had the students practice coming up with questions to ask their doctor. In addition to reviewing the definitions of health literacy, misinformation, and disinformation, I explained the differences to the students with a basketball metaphor. I said that misinformation is like when you try to make a basket, but you miss the shot. Disinformation is when someone deliberately blocks you from making the shot. Also, for the activity where I discussed how to recognize red and green flags on social media, I asked the students to contribute their own ideas of how they recognize trustworthy social media. The main activity for this module was a 4 corners exercise, where students have 5 statements about health information, and in response, they either agreed or disagreed. After students moved to a corner of the room, I engaged with some of them and asked about their reasons for their choice. These examples were chosen to show the complexity of evaluating information, meaning in almost every case, I affirmed the students' reasoning, and in certain cases, I also challenged them to consider a different situation where the reverse may be true. In this example, the student recognized a medical doctor's authority, but I also asked them about a case where an article was retracted or falsified by other scientists or physicians. Finally, I had the students practice evaluating social media posts, and I demonstrated how I searched to verify or falsify a claim that a social media post makes. This is a part of the curriculum where you will want to download images and URLs of example social media posts related to the disease topics the students are working on. I would recommend downloading a variety of posts, meaning some of the posts are from less trustworthy sources and some from recognized experts, so the students understand that some information on social media may be trustworthy and other information may not be. Also, I would recommend downloading these posts in advance and providing them to the students in slides because many schools may have social media blocked.
Module 5, Citing Sources and Differentiating Scholarly and Popular Literature. In Module 5, students explored the differences between scholarly and popular literature. They learned how to identify each type and understand their distinct purposes. We also defined plagiarism and discussed when and why citations are necessary. Students examined the importance of proper citation and were taught how to cite sources using APA style. These skills were applied to their final projects, reinforcing the importance of credibility and proper attribution. We began a Do Now activity focused on distinguishing between scholarly and popular literature. Each student received 2 index cards, 1 green and 1 red. As I presented different examples, students held up the green card if they believed the source was popular literature, or the red card if they thought it was scholarly. They briefly explained their reasoning, helping reinforce key characteristics of each type. This interactive warm-up set the stage for deeper discussion later in the module. In this activity, students learned how to determine when a citation is necessary, an essential part of research integrity. We began with step 1, where students completed a handout that included examples and space for explanations. They had 10 minutes to work through this independently. In step 2, we moved into an interactive segment. Each student again used colored index cards, green if they believed the example needed a citation, and red if it did not. After voting, students shared their reasoning with the class during a 5-minute discussion. This activity reinforced critical thinking and citation judgment in a fun, visual way.
So feedback from students the second year indicated the high levels of engagement and learning. They indicated how much they understood about the work that a librarian does now and how much they enjoyed the final project. Sarah's going to read a few quotes for us.
What I learned was learning in depth about health librarians. 'Cause at first I was like, what is that? Is it just like a normal librarian? So I got to learn more about the differences in the career and how much work they actually go through, which is a lot, especially in the research process. I learned about spreading false information. It is very fascinating how people are just going to take what you say without really looking into it. What I liked about the curriculum was we got to pick our medical condition. It wasn't forced on us. I got to learn about Billie Eilish. I never knew about synesthesia either.
Students told us how much they enjoyed the various activities and what they learned about.
It was really fun how we got to work together to create the slides. My group researched epilepsy with little Wayne. He was diagnosed with epilepsy, and our claim was, do you know what scissor is? It's popular with rappers and singers to do it, and it's like drugs. It's like lean mixed with stuff. We did research on whether that was one of the factors that led to his seizures. It turns out that according to the National Library of Medicine, it can lead to seizures as well as fatality. In a study, it led to death in a lot of people, like over 50%. I would say it is a good experience, and I definitely learned about what it takes to be a health librarian, what you need to become a health librarian, the different types, and how important the job was.
So these are the students' final presentations. 3 of these were at Mount St. Michael's Academy. Each school had a first and a second place award for the 2 teams who were most outstanding in their efforts, and we gave them a small monetary prize. All students put effort into their final presentations. These were other student presentations, and these were from Kappa. Could you take a look at this QR code and use it to access our curriculum? We would love it if you would use it, and we'll leave this up for 30 seconds or so. We'll also note that we're putting the link to our resources into the chat as well, so whichever is easier for you to access. We would love to have you take and use our resources. We want to acknowledge the Institute for Museum and Library Services for providing us the resources to do this grant, to conduct this work. And now is your time to ask questions. And while we're waiting for questions, was there any questions in the chat, Benny, that we should pay attention to right off during the presentation?
There's no questions in the chat yet.
Okay, so one of the questions that came up, that has come up for us was, and in fact, was something that we were asked when we were preparing this, was how did you get into the classroom to teach this curriculum? So would one of our panelists like to respond to that?
I'll respond to that. It's particularly difficult to get a push-in opportunity within the New York City school system, the Department of Education. So push-in is when you're actually able to teach during the school day, not like an after-school program. And one of the reasons we were successful with this endeavor is due to partnership and our collaboration with the program Mentoring in Medicine. Mentoring in Medicine had established a program where they had the opportunity to join classrooms in real time during the day across multiple schools, across multiple boroughs. And so partnering with them allowed us that opportunity. And I know Jessica Boyle, who works very closely with Mentoring in Medicine, was one of the people that worked with Mentoring in Medicine to make that happen when they first started partnering with schools to introduce their programs. So partnership and collaborations is a really key component of making a program like this successful.
So I see that also there's a question in the chat, and this kind of goes with it. How much classroom time was needed? So with schools, be it if they're private, public, you're going to get a lot of different timing for how long a class is. For example, at my school, we run 90-minute blocks. At other schools, they run 45-minute blocks. So in this case, this program is run for 2.5 weeks. If you're doing a 45-minute block, 45-minute class session, and basically it was about half the time in my school because it was 90 minutes. And in the toolkit, there's actually two different agendas depending on the school. But it was meant for the entire class period. So for the whole 45 minutes or 90 minutes, this program ran. So it took about 12, 10 to, it depends on the class, but about 10 classes.
So Diana put some information about this in the chat, but if you folks have thoughts on, are you seeing students writing prompts in ChatGPT to get answers to health information?
So I think Jessica might want to take this on too, but in terms of this particular curriculum, we did not see that in the classroom. We allowed groups to have group work activity at the end of each module. So they had time to work on their final projects or their performance learning task within the class with their peers to ensure that they, understood the curriculum and we could guide them through selecting resources or answer any questions that they had. And we did not observe them using ChatGPT for this work. They were using the resources that we introduced within the curriculum. They were also using Google, and they were also asking questions about the source, whether or not we felt it was good and credible and that sort of thing. And they were going through the steps of SIFT to determine that on their own. I don't know, Jessica, if you want to
Yeah.
comment on
That I
outside
can.
of that,
So I believe still ChatGPT in the Department of Education, it was blocked. It might still be blocked. So there is some blocking happening on the computers. However, there is definitely a student use of, um, you know, AI throughout, I would say. However, not necessarily for this class and not for this project. There was always a lot of, for example, in my room, I was there, but like Diana or Terry, there were multiple instructors in the room, which definitely like we were interacting with the kids the whole time, and you could see on their computers what they were, what they were working on, and they were collaboratively also working on the slides. So for this, interestingly enough, we really didn't see it at all. If Especially because you're doing it in the classroom with people circulating. If you told them to go do it at home, I think you would probably have more of that. But because this program is designed specifically to provide the work time, that way students can ask questions, you can answer them, and you can guide them. They really weren't using that to produce their work, which is great.
So Maria Avery has a really interesting question in the chat. She's wondering if there's utility in presenting only a single module as a starting point if you're not able to get into the classroom more than once. It's a great question, and I've been thinking that if I wanted to only teach about medical careers, medical library careers,
Yeah.
module 1, I'm trying to remember, module 2, think it's module 2. Module 2 might be the best module to start with. If you're only teaching about health literacy, you might want to start with module 1 that introduces Medline Plus and see if you could fold it in with module 3 that goes through the SIF method if you were doing health literacy. Other
I can
panelists, thoughts
I
on
can
that?
add actually, I think, Terry, the great thing about this is also if you only have 1 or 2 sessions, each session does have that little bit of work time and even like something the kids would be producing. So it's not just I'm going to talk to you about this. There's either the the career, the librarian career, that kind of can stand on its own. But and all the others at the end, there was going to be a slide produced or like something produced. So as Terry said, depending on what you want to teach, you're going to have some type of product to assess the students on or a deliverable for the students. So that way you can pick what you want. So maybe your end product is only 2 slides, right? Maybe you want them to focus on like research and then they just research, that they choose the disease that interests them, the celebrity, and then produces that one thing. So I actually think it could lend to that quite well.
So there's a
And
question
go
in the
ahead.
chat about whether or not you considered using PubMed um, as well or instead of, and what your thinking was about not choosing to include PubMed.
Actually, students did use PubMed. So students were tasked to find their own research information that was credible using the SIFT evaluation framework. And so there were students that had pulled articles from PubMed, particularly books. I mean, if you do a search, PubMed can come up. And so like the small amount of books that are indexed in PubMed, some of them came up and were used as resources for some of the group work. Ultimately, I will say though, most of the references used was popular literature. So it would be information found on Medline Plus or information found on society sites that are targeted for patients. And so a lot of the resources were popular in scope, but they were well vetted. The students did a really great job vetting the sources through SIFT. And there were a couple of teams that did find links to PubMed proper and use that in their reference list as well.
I would love to answer Michelle Price's with how did the students pick the celebrities? Because this is one I think of the coolest things about the performance task. And all of the librarians really worked quite hard on this. So basically, the students had a list of many, many, many different celebrities with the diseases. So they got to choose off of a list. And then what we did was it was kind of like live. And the groups, once they figured out who they wanted, they added their name to like a live document. So students didn't have the same celebrity or disease. And all of that's in the toolkit. So a lot of the research and even the social media posts, all of that is there in the toolkit. But that was one of the things that the students really enjoyed doing. And I forgot how many different celebrities and
Well,
diseases.
I was gonna make a point to that. What was hilarious was Jessica had to kind of like tell us to slow our roll because as librarians do, we had a list, right? So we had tons of celebrities and tons of illnesses, chronic illnesses and stuff. And she, observed the list and she was like, you guys really need to shorten this. So the list could have been, they would the labor making a selection, a choice if they had those so many options. So we actually did make the list shorter, and I think it was probably 20 to 25 maybe celebrities that we offered.
And the reason why, well, 20 to 25 is still huge because any
I
teacher
think it was
knows
at the end. But
any teacher knows you're gonna have to. So for each one, then we had to go find the posts, find the claims. So in order to be able to guide the students, you need to know all, like really know all those answers and have those links and be able to guide the kids. And so for each one of those, there are actually like the different posts and everything that goes with that particular disease. So.
And I would say for the social media posts, like I don't think we just included an example or two in the actual toolkit because you really need to get up to date stuff. So like you have the students pick the diseases and then do a search. I found that X was probably the best one just because it's more text based and link based. To get examples of social media posts talking about the different conditions so that way you can help them evaluate them.
And in different schools, you're going to have different social media fully blocked. So if you want them, you have to work around that sometimes.
So it looks like folks are really interested in using some or all of this. And there was a good question about crediting if they're going to use the work that you've done. Is there especially since you taught your students about using citations, what is the best way to do that for this project?
I'm sorry, Sarah, could you rephrase that?
So there's a question in the chat of how you would all like to be credited if they use some or all of the uh, work that you did on this, if they're using it with their own students.
I don't think we've addressed that.
no, I think according to the license we chose with the grant, Andy, I was it
Is it Creative I don't know.
yeah, it's Creative Commons
Oh,
license.
okay.
I think it just required a citation. Am I correct, Andy, in that?
Yes.
Yeah. So it just requires a citation, and you can use the tool to, the modules as standalone. You can use components of a module. You can use all the modules. You just need to reference the work. And I think the LibGuide with the toolkit link and would be enough to reference.
I was going to say David Duggar has a question about did any of the students have a science fair but we sort of did have it as a science fair style at the end. We had a day where it was like all the projects were presented. But I don't know. I don't
Yeah.
know if Jessica knows anything. Yeah.
I can say so as for like the greater science fair like of the Bronx, no, none of the projects necessarily um ended up like leading to that. And if they kind of even have one, basically at the end it was just, the celebration of learning. And then in the first round, the students made more of like poster boards. In the second round, they made more of slides presentations using, Canva or something that they particularly felt that they wanted to use. They could though, the what I found is like the fairs, like when I've had a student do it, it's just been a district wide or a borough wide, and then you get an invite and like a teacher or a student does a project, and I've had that for my upper level sciences, but.
So we do have a little bit more time for questions, but for folks who may have to go, Benny is going to throw the evaluation link into the chat for we appreciate feedback from everybody. But you will, if you are getting Cs, need to go through that. Um, Especially the CHE, the CHES for our public health partners. Make sure you have your CHES ID ready for that. And if you are getting CHIS or MLA credits, please let us know because they weren't unfortunately correctly um, associated with the evaluation. And so we have about 10 minutes more for questions if there are more coming in. And I do see, will you be following up with the students to find that if any are going to pursue being a librarian?
I do want to respond to that question. We partner with Mentoring in Medicine because they traditionally do a longitudinal follow-up of their students over time. And that was part of what we put into the grant. We were not planning to follow up with them directly. However, we can reach out to Mentoring in Medicine and see if they were planning to follow up with them. And especially if we were to do another grant, we would use that kind of follow-up to see how successful this particular intervention was. And it will take some time. For example, the students in Kappa were sophomores, and the students at Mount St. Michael's were seniors. So of course we would know a little bit sooner about the students graduating from Mount St. Michael's. So there's a question about the evaluation link, and there's a question about the CE credits. Okay. And then another question that came up was, how do you know if the kids answered the focus group questions honestly? So what we did, because I have to say, I was pretty astounded. The first year, the focus group feedback was pretty like we're kind of bored and we don't know what you guys are talking about and blah, blah, blah. And the second year, it was so incredibly different. We didn't do anything differently between those 2 years, but what we did do in both cases to make sure that we weren't prejudicing the responses was we had an independent group of students who work for Mentoring in Medicine go into the classroom the following day after we finished our last presentation and engage them with a group of focus group questions. We tried to keep the focus group questions the same before the intervention and after the intervention to see what they could tell us about what they expected to learn and then what they actually did learn. And the focus group question responses were just amazing after the second year. So we really felt like we did do something right, and we hope that we captured them correctly. Because the students were trained to key in, and then we also the second year we audio recorded the questions so we could get more of the context around the responses, which was really helpful. Andy, I don't know if you wanted to say more about that.
No, I think you summarized it pretty well.
I was just going to share, I thought Jessica in particular really helped us revamp the curriculum to make it more appealing to the high school students. And I think if you're going to do a curriculum like this, if you are a librarian, if you can find a teacher to partner with you in particular to give you feedback, because the teachers are the ones that are doing this every day. You know, teaching high school students, we learned, is very different from teaching college students or adults, or, you know, so just keep in mind the teachers do great work. And if you can find a teacher partner to do something like this, I think that's a good way to do it.
And also, the kids are usually really honest. If they don't like it, they're going to be the first ones to tell you because they don't want to hear it again. But if they did like it, they'll also be the first ones to tell you because they're actually really also want to, they want to please as well. So they're usually pretty spot on.
And I want to acknowledge Sandra Franklin from our advisory board for all of her work. So what she did and what her colleagues did was every month they would go through what we've developed and what we plan to present, from our pre and post test questions, our focus group questions, each module and how we were planning to present it. And they were really observant, and I would say in some cases critical about how we were presenting. They really wanted to help us and coach us so that we presented the material in a manner that students would most engage with. And I think that they were really successful in doing that. Sandra, did you have anything you might want to add?
And one thing we didn't mention in the toolkit, there's videos from some of the advisory board, them talking about their career paths. So don't forget, you can use those too.
Yeah, that's a really good point, Sarah. So we asked each advisory board member the first year to talk about how they discovered the career of librarianship so that students would have individuals whom they could relate to about their stories. And we removed that from the curriculum after the first year because they said there was so much lecture, and these, like 3-minute videos from each advisory board member seemed like a little bit more lecture, so we did remove it, but we still have it available. So if any one of you want to use those 3-minute stories, they are absolutely powerful stories.
So Terry, thanks. I couldn't unmute initially, but someone gave me permission to do that. But I put in the chat that I'd just like to congratulate Terry, you and your team. I think this was a great project. It was something great to be associated with. And when Terry and I first struck up a conversation about this at a Medical Library Association meeting, and I knew she was in New York, and that's when I told her about Lynn Holden and mentoring in medicine. But I do think it's something that others will want to replicate, and a great way to not only educate the students about library careers, but also some of the teachers as well. You might find some teachers who get interested in saying, hey, I might want to be a librarian as well. So thank you all for just allowing those of us who are on the advisory board to participate. And I would always tell Terry, sometimes I felt like I didn't give it as much attention as I'd like to, but it still was a great experience just to watch all of you take that learning, and especially after the first year, because I think you were kind of down and like students. Oh, no. So Jessica, thank you for what you did to help them kind of revamp a little bit and take that back and be so successful. I think it really was a success. So thanks. That's what I'd like to share.
Thanks, everyone. It looks like, have we covered all the questions in the chat, I think?
So I think we did. We are basically at the end of our hour. There's one last really quick question. I think that's about what we have time for. But we are getting quite a few people who seem to be very interested in replicating some or all. And then I wanted to say thank you all for joining us today. If you have questions about the session or about NNLM, please feel free to reach out. Otherwise, and hopefully we will see you at trainings in the future.
Thank you so much, NNLM, for hosting this today.
Thank you.